Okay, it is 9 o'clock on September 17th, 2020, and I'll call the Humboldt County Board of Health meeting to order. First thing we'll do is a roll call. We'll start with Dr. Stringham
I'm here.
and Sheriff Allen.
I'm here. Good morning.
Good morning. Commissioner Cherry,
Here.
Commissioner Risden,
Here.
Commissioner Bell, Commissioner Bell, Commissioner French, Commissioner French, County Manager Mendiola, are you on, Dave? It's not. I think we have a quorum. We will
Mr.
go on.
Chair, it's
Yes.
Tammy. Do we have legal counsel present?
We have legal counsel, Mr. McDonald, Ms. Maddox. Guess we better be good then, huh?
Mr. Chair, this is Abel. I'll contact Ms. Maddox to see if she's available, and I'm here as well for the board.
Okay, thank you, Abel.
You're welcome.
Are you here now, Wendy?
I'm here.
Okay,
Oh, that's Wendy Nielsen. That's not Wendy
Okay.
Maddox.
okay.
True.
Good morning. Dave Mendiola and Commissioner French are here.
Okay, thank you. We're waiting on legal counsel.
Did Dr. Stringham get on?
Yes,
he
I sure
is.
did.
Great, thank you. You want to be on camera?
No.
That's pretty. Is it bad?
Commissioners, Wendy has child support hearings today, and Mike McDonald is not available.
We will go on and behave ourselves. Okay. The next order would be the Pledge of Allegiance. Do we have a flag?
Give me 1 second here. On the side of the road, but I can pull this off.
Are you and Commissioner French on your way to Elko?
Correct.
Yeah.
The marvels of teleconference meetings, huh?
Well, I'm having trouble here finding the right site here, so
We have Wendy on now.
if we can just go forward without it.
Okay, we'll dispense with the pledge today and we'll move to public comment. And just to remind everybody, public comments for anything that's not on this agenda. And if you have public comment, you'll need to *6 your phone if you're on the phone. Unmute yourself and please identify yourself for the public record. Public comment. Is there any public comment? Hearing no public comment, we'll move on to the next item, which is an update from the Public Health Officer, the local emergency manager, and public information officer on the county response to COVID-19 coronavirus. Presentation by Dr. Charles Stringham, Public Health Officer, Captain Sean Welcome, Humboldt County Sheriff's Office and Local Emergency Manager, and Nicole Maher, Public Information Officer, regarding the current status of Humboldt County's response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, as well as updates regarding other efforts to mitigate the spread of the virus. In addition, the group will update the board regarding the dissemination of information to the public through various methods. And we'll start with Dr. Stringham. Good morning, Doctor.
Good morning to you, and good morning, everybody else. In general, we have some good news today, and I'm very pleased with the way things are going in the county. We have a lot to be thankful for, and as always, I want to start my comments by thanking the people of Humboldt County, because I think things are going really well in general. Some room for improvement, but in general, things are really going nicely for us. So essentially, the first thing I'd like to report is the number of cases that we're dealing with, and that number over the last 2 weeks since we visited stands at 6 additional cases, and there are 5 active cases in Humboldt County now. There was one patient who was admitted to Humboldt General Hospital, transferred to Reno, but very thankfully that patient has been discharged and is doing okay at this point. So I think we have a lot to be thankful for. The biggest of the developments to report this week is the school reopening, of course, and I think things are going very well there also. Dr. Jensen and I, Superintendent of Schools, have talked on a number of occasions, and I've also talked to Miriam Tyree, the school nurse, and I'm very pleased with the way things are going in general. So Dave had outlined a program that was set forth initially by the CDC and ratified by the Nevada Department of Health and Human Services. And we've looked over that very carefully, and I agree with the content. Wanted to make a couple of comments and kind of define for each of you the reasons that this guideline is not an easy one to follow, but I think in the end, I support it wholeheartedly, and I think it's the right approach. So essentially, anytime that we attempt to bolster, to increase safety, we're always going to do that at the expense of convenience. And I've kind of felt for quite some time in other areas as well, aviation and medicine and various other endeavors, that safety essentially is the opposite of convenience in a lot of cases. And many of us like to short circuit systems and make things easier and thus more convenient. But in general, that usually detracts from safety, and COVID is no exception. So essentially, the system that HHS has ratified in Nevada is very similar to what's going on in other states. There's really nothing specific about it. It's a very generalized program. I think that it draws the lines a little bit closer to safety and further away from convenience. And that's not surprising, but I think that the difficult part for people is that people are having a hard time kind of grappling with the fact that it's going to be very difficult to do the one thing these types of programs aim to do, and that is create a lot of specificity and clear lines in areas where there used to be a lot of gray. And so I think that's one of the things that makes it a little bit difficult. So essentially, the system creates a fairly broad net and essentially winds up ensnaring people who probably are not infectious, but it does that anyway so that we're able to increase safety. And the problem is, for every single case that we're very thankful that we quarantine somebody, there may be 5 or 10 cases where a person was quarantined unnecessarily, but it's kind of the nature of quarantining. It works a lot the way seatbelts do. You don't generally expect to end car rides with the sentence, "Thank God I was wearing my seatbelt." And you may have to wear a seatbelt 10,000 times before it helps you even once. So I appreciate everybody's understanding in kind of acknowledging the fact and accepting the fact that that's what it takes to be safe in our community and others. So in terms of other issues, I would ask that the people of Humboldt County, parents, students, faculty members of the schools, that everybody please try to be honest in reporting symptoms. The screening process really relies on self-reporting and honesty, and it's critical that everybody be honest in reporting the symptoms on a daily basis that you may be having, and be sure to cooperate with all the quarantining efforts and the contact tracing in the event that that becomes necessary. I'm also very pleased that Miriam Tyree has been added to our FAST team as a representative of the school, and we have a large group text that we all work with, and so information spread very quickly in real time. And the reason is because the guidelines are very generalized, but with the FAST team and various other resources, we really can be providing excellent services in real time and not have to group students together into categories, but rather have each case individually acknowledged and risk stratified. And I think that in the end will help us to curb a lot of the problems with this system. One, for example, is a child who has longstanding asthma, who has a cough almost every day. And then in the era of COVID, what do we do with that student? And the answer, according to HHS doctrine, is that that student is placed in respiratory isolation, even though it probably isn't necessary. And so the FAST team and I and Miriam will be able to dialogue in real time and assess risks and be able to get students back to school if they present no significant threat. So in terms of other things, if there are other specific questions, I'll be happy to answer those for people at the end of the comments. I anticipate that there likely will be questions based on the fact that it's kind of a fairly impassioned topic. In terms of community trends, we have a number of different things that are going on. We really are doing very well in general. I think it's still the case that there have been no cases in Humboldt County transmitted in what we call managed environments, meaning stores, official places where people follow rules and people officiate those rules. I'm very happy about that too. So a lot of work has gone into that, a lot of community participation, cooperation. These things did not just happen. I'm really pleased about the way things are going. To remind people, I'm starting to see more people not wearing masks these days as I'm out in the community, kind of walking around and looking. And it's important that everybody wear masks. This is not over by a long stretch. Alicia Heiser had informed us by email recently. I know that most of you probably received that too. I was very pleased. There were 15 samples that were sent off. And at the time of Alicia's last receiving of information, there were 10 assays that had all been shown to have concentrations of viral RNA lower than detectable levels. And in fact, to the best of my knowledge, there were none that showed any detectable virus. I think this is a wonderful sign, and certainly the sign that we're looking for. In the end, I don't think the community wastewater program will show us real numbers, but that is a wonderful thing because it means that we're doing a really good job. So that's a fantastic thing, in my opinion. Wanted to talk a little bit about McDermott cases. Pleased about what's going on there too. I've talked to Dr. Bay, and since August 25th, at least as of 48 hours ago, there had been no new cases in McDermott. The CDC, Centers for Disease Control and Prevention, actually has 2 representatives. One is a PhD. Very impressed by the response that they've had. I'll be dialoguing with them early next week during a meeting that's scheduled. And they're essentially here to teach McDermott how to behave, how to feel about this, ways to contain the virus. And it seems that that the McDermott officials have already been doing a wonderful job prior to CDC arrival. So also very pleased about the way things are going there. Again, that didn't just happen. It required a lot of participation. Vaccination status, not much is going on with this at this point. Some of the news is kind of ambiguous. I just wanted to decipher it a little bit, give you some information on that. The federal government is, it sounds like somebody may have to mute. If you have a live mic, go ahead and mute that now.
Okay.
Okay, wonderful. Thank you very much. So the big news is that the federal government has recently been putting out quite a lot of information about the vaccinations and anticipating various schedules and things. I'd like to remind people that in the end, the good news that we receive will come from industry and the people working on the vaccinations and the people who actually are testing these vaccinations. What the federal government is doing is providing infrastructure so that when those vaccinations become available, they will be more widely distributed, and the distribution system is being put into place. And it's a lot of politics and politicization that's going on right now. And so a lot of mixed messages that people are receiving about the readiness of vaccinations and various other things. And I would caution everybody to understand that I feel very confident that a vaccination will be available over the next several months, and to realize that as the election draws closer, that a lot of the information that you'll be receiving will be designed to politically motivate rather than to truly inform you of what's actually going on. Russian vaccination, have not heard much about this. We know that people are being vaccinated in Russia. We know that the vaccination does seem to produce antibodies, so at least it has some effect, but have been looking and doing almost daily research on this, and have not seen very much coming through on that, which is somewhat disappointing because I think good news certainly would be vigorously reported. The other kind of somewhat discouraging news came from Oxford and the AstraZeneca vaccination, and there was a single individual who became ill as a result of the vaccination. So AstraZeneca has slowed progress in order to evaluate that. And I don't want anybody to interpret that as being bad news. I think this is expected to happen. This is experimentation. We really don't know exactly what's going to happen. This is one of the reasons that we need to be very safe. But this is not reason to be discouraged about vaccination, either that particular one or vaccination as a general concept. So, in closing, I'd like to let people know that we have a lot more to be thankful for here in Humboldt County than we have to be concerned about. People are generally engaging. They're generally doing the right things. I'm very happy with the work that our board is doing. I'm really pleased to be a part of the board. And I'm also really happy when I look into the community and see the acceptance that people are using and the application of some of the concepts that we're putting forth. So I think in general, things are going well. I would urge every single person in Humboldt County to continue to do the right things. And I would also urge everybody to use extreme caution when either dealing with people who are from outside the area, even if they're not from areas that are particularly endemic to this. We're starting to see where people are coming into the community from other areas, and those people in some cases have been infected. And I would remind everybody that we still have a quarantine, a mandatory state quarantine in effect, that if you come to Humboldt County as a visitor, it's mandatory that you quarantine. And a number of different events that we've hosted have made that a little bit ambiguous. But the bottom line is, if a person comes here to work and do other various things, it's critical that we cooperate with each other. We've had about 3 cases over the last several months where a visitor has come in from out of town, has immediately gone to work, and has then been known to be infected, and the mandatory quarantines were not respected. And I would like to point out that there have been no transmissions in such cases. So nobody's become ill as a result of that, but it's still a very dangerous behavior. So if you work in an industry where you're servicing people who come in from outside areas, gas stations, primary convenience stores, retail stores, other types of establishments, restaurants, use extreme caution and know that you're actually protecting the community from virus that may come in from the outside communities. Thank you very much, everybody. I'm really pleased with the work people are doing, and I'm very proud that that the people of Humboldt County are taking this seriously and doing the right things. Thank you.
Thank you, Dr. Stringham. And we'll move to, if somebody has a question right now that you want to ask Dr. Stringham, you can go ahead and do that. Otherwise, he'll take questions later as well. No. We'll move forward with Captain Wilkin and his report as the local emergency manager. Captain Wilkin.
Good morning. This is Sheriff Allen. Captain Wilkin is unavailable today due to another obligation. However, he did brief me this morning, and there is nothing new to report on his end. Everything's very stale, I guess, from the state. We're not hearing anything from them, and so no news is good news. So thank you. That's all we have on the emergency management end.
Thank you, Sheriff. I appreciate it. We'll move on then to Nicole Maher. Wow, I'm having trouble getting my words out. Nicole, are you there? Nicole Maher? I don't. If you're on, Nicole, you need to unmute yourself.
Mr. Chair, Dave Mendiel. Nicole is on, so she may be having some trouble unmuting, but she's definitely in the meeting.
Hi, it's Dr. Stringham for the record. I'm texting with Nicole now, and hopefully we'll be able to get some information about what's going on with her. She's responding as we speak.
Okay, we'll hold it just for a moment and wait for her.
She says she's here and that she's having a hard time getting her mic unmuted. She's going to call back in.
Hi, can you hear me now?
We hear you, Nicole.
Okay. Sorry about that. I'm not sure what happened with my phone. It just wouldn't recognize the unmuting. Well, over the past 2 weeks, our local key messaging themes have included discussion about social gatherings and celebrations without preventative measures and how those can quickly spread COVID-19. We've also shared a lot of information about the drive-through flu pod, which is coming next Wednesday on September 23rd, and encouraging people to get vaccinated. And Dr. Stringham has said that the convergence of these two illnesses of flu and COVID on Humboldt County could result in some very serious outcomes. So we want to encourage people to get vaccinated against the flu. We have reassured school communities that in the midst of uncertainty and anxiety, they can rely on those things they know will reduce the risk of COVID-19, including wearing masks, distancing socially where possible, and washing their hands frequently. And we've issued a reminder that even though the number of daily cases in Nevada has been slowly declining over the past weeks, as Dr. Stringham said this morning, we cannot let up in the fight against this ongoing pandemic. And there's some interesting things I'll share today that will show what's happening around the world that speaks to that. So in the county, Dr. Jacqueline Bay, who Dr. Stringham mentions, the health director of the Fort McDermott Wellness Center, she has reported just in the past several hours that McDermott now has 91 cumulative cases. That's up from 7, or that's up 7 from 2 weeks ago when they were at 84. But need to explain that a little bit. So 76 of those were tested through Fort McDermott, but these latest 7 were identified through outside clinics. And so most of those people have actually already recovered. So as of today, McDermott has 1 active case and 89 people have recovered. The Office of the Humboldt County Community Health Nurse, Marsha Foreman, continues to test asymptomatic people, and people can make an appointment. And so far, we haven't had any cases come out of that clinic. Golden Valley Medical Clinic, which, as you know, is a private health clinic operated by Nevada Gold, is testing both symptomatic and asymptomatic mine workers and their families with a doctor's order. And one of our recent cases was actually diagnosed through that clinic. And then, of course, going back to the flu pod, I want to encourage people, it's from 4 to 8 p.m. on Wednesday, September 23rd. Wear a mask, bring a pen, and again, this is a very important year to be vaccinated. So on our local social media channels, residents have been wondering what the parameters are going to be for Halloween and trick-or-treating. Most seem in favor.
We lost you, Nicole.
Yeah, we've lost you, Nicole. If you can.
Expressed sorrow and disappointment that students have to wear masks and social distance.
Okay, Nicole, we lost you when you started to talk about Halloween.
Okay, can you hear me now?
We can.
Okay, let me go back. Thank you. So just going back to the Halloween thing, they've just been wondering what the parameters are for Halloween and trick-or-treating, and most seem in favor of trick-or-treating, whether that's house to house or during a trunk-or-treat event. Residents have also been very supportive of a local pharmacy that had to close due to a potential COVID exposure to some of the employees, and I was impressed by people's reaction to that. They were very grateful to that pharmacy for taking needed precautions, and in fact, it seemed to heighten that pharmacy's stature in their eyes. And so I thought that was very positive. Some people on local social media have expressed gratitude that school is back in session and that district employees were able to return to their jobs. And others have expressed sorrow and disappointment that students have had to wear masks and socially distance. And I don't think those are mutually exclusive. I think folks feel grateful, but also sad that our circumstances are such as they are. On the state's social media channels, as you're all aware, last Sunday, President Trump held an indoor rally in Henderson, and that was his first since June, when he had one in Oklahoma. And reaction on the state's social media channels has really been mixed, from those who celebrated the maskless shoulder-to-shoulder event to those who echoed the governor's. Can you still hear me?
We can. You kind of faded out for a minute, but now we're back.
Okay. I can tell because there's a woman's voice that keeps coming on. So, just really mixed reaction between folks who were grateful for that visit and that opportunity to rally, and those who were very worried about that. In an interesting side note, you might have heard this as well. The event was held at a place called Extreme Manufacturing in Henderson, and that owner was actually fined $11,000 last month by OSHA for not following coronavirus policies at a Trump campaign event, and kind of like a beauty pageant. Those were two separate events at a hotel on the Las Vegas Strip. And this week, the owner was fined $3,000 by the city of Henderson for violating COVID-19 rules as part of the rally. So as far as our situational report, the state has now tested just a little over 950,000 people, or excuse me, performed 950,000 tests. That's up just shy of 91,000 tests from 2 weeks ago. In the state, we've seen a significant decline in deaths. We have 1,494 deaths. That's up 158 from 2 weeks ago. But you might remember that 2 weeks before that, or even a month before that, we were looking at significantly higher numbers. As Dr. Stringham said, we are up 6 cases from 111 to 117. You might notice on the state side it says 118. That is a mistake. So we remain at 117. We still continue to track in the state as having the 4th highest death rate. Washoe up 1,782 from 2 weeks ago as far as their cases. And I want you to notice these numbers with some of these other counties. Clark's numbers have been going down pretty significantly, but some of the other counties have been going up. Let's see, Washoe's at 150 deaths. That's up 11 from 2 weeks ago. Clark up 3,200 cases from 2 weeks ago. They're just shy of 1,300 deaths, which is up 141 from 2 weeks ago. Lander just hit 70 cases. That's up from 63 cases 2 weeks ago. 1 death, no change there. Pershing remains the same. 21 cases, no deaths. And Elko, thankfully, has slowed somewhat. They're at 902 as of yesterday afternoon. I haven't checked their numbers this morning, and they're up 64 from 2 weeks ago. 8 deaths, and that is a really unfortunate situation. COVID got into their nursing home, and they've had 3 deaths from what I understand so far. And many of their staff members have been infected who work in that nursing home. And so Terry Clark, who is kind of my contact over there, has said they've really been scrambling to try to get things where they need to be, but it looks like that situation might be turning around. So going back to that indoor rally in Henderson, Governor Sisolak sent a letter yesterday to Vice President Mike Pence seeking clarity on the state's efforts to follow the recommendations from the White House Coronavirus Task Force, which it appears Nevada was trying to follow, and just need some clarification there. On a good note, the state monitors weekly reports put out by that White House Coronavirus Task Force, and for the second week in a row, Nevada has been downgraded from red to yellow. And so it looks like as a state, we're doing a lot better. The governor has asked a group of state government experts, these things they represent, they remember business, law enforcement, public health, and they're going to conduct a deep dive evaluation of our current standards and our restrictions in Nevada, including our gathering limits and our statewide capacity. And once this is developed, the governor said he'll make an announcement whether we might see some easing in restrictions. This would be particularly important to church gatherings and business meetings, things like that. State COVID numbers, as I mentioned, are getting lower, and the state wants to ensure it continues that trend, even if it were to relax restrictions. As I mentioned before, it's been interesting and just something we want to watch to see the ratio of new cases change over the past several weeks. I I look at this every day, and the high majority of new cases used to be in Clark County. I mean, when I used to look at this, Clark was up in the high 90s as far as the percentages of carrying the cases in the state, and that's now changing pretty dramatically. For instance, yesterday, only 60% of cases were in Clark County, but we've seen numbers going up in Washoe, so 20% of total cases were in Washoe, and another 20% were spread throughout the state. So just I'll be watching that to see what that looks like over the next couple of weeks. Following last Thursday's meeting of the COVID-19 Mitigation and Management Task Force, Lander County, Lyon and Nye counties have all dropped off the state's list for elevated risk of transmission. Churchill, Clark, and Elko remain, and Eureka has now been added to the list for the first time, which is really sad because you might remember a month or maybe it was 2 months ago, I mentioned that Eureka was kind of an anomaly in the country because they had not had any cases. This one was interesting. You might have heard about this. The Idaho Senate passed a resolution urging their governor, Brad Little, to end the coronavirus state of emergency. The resolution says lawmakers will look at the governor's spending authority in 2021 and how long he can extend that emergency declaration. They would like to put a prohibition on ordering a quarantine for healthy people. And as Dr. Stringham said, sometimes we have to balance risk with convenience. And so it's interesting to look at where their leaders are headed with this. So now this was after members of Idaho's House advanced a resolution that would end Idaho Governor Little's coronavirus emergency declaration, and they were willing to forego about $117 million in federal emergency aid money. That resolution did not advance because there were some concerns raised about its constitutionality. So the federal government has denied Nevada's request to fully fund the Nevada National Guard's COVID-19 response through the end of the year. And so the governor has said that they'll use some of the coronavirus relief funds to cover the state's share. Those National Guard members have been really important as far as as far as statewide testing and things like that. And so it seems important as a state to keep them going here. As of yesterday, so that's our statewide hospital occupancy rates are at 72%. That's the same as 2 weeks ago. ICU units, 60%. That's down from 61% 2 weeks ago. And this one was interesting. Ventilators in use, 40%. That's up from 36% 2 weeks ago. Division of Industrial Relations continues to monitor businesses across the state for any violation of workplace health and safety measures. A week or so ago, 3 Northern Nevada businesses were fined approximately $2,500 each for non-compliance violations. So that included a Quick Mart in Sparks, a tire and service business in Dayton, and an automotive business in Reno. But during this past week, yesterday, DIR did not issue any new citations, and they actually found 100% compliance in the 53 businesses that they visited. So that was really good news. And since June, officials have found a cumulative 89% statewide compliance rate. So I thought that was good too. Kind of sad on the world stage. Earlier this week, the World Health Organization reported the highest one-day increase in coronavirus infection since the pandemic began. That was more than 308,000 new cases. India led that. United States was second, and Brazil were the 3 biggest countries logging the largest number of infections. Also of note is that Europe is now seeing a surge in coronavirus-linked deaths as those countries move into the fall months. But on a good note, so Australia is ahead of us as far as flu season, and they are seeing declined in their flu cases, and they are pretty sure, makes sense, that it's because people are wearing masks and socially distancing. So that helps us be hopeful. And in some exciting news, Nevada is among 6 states that were removed from an eastern state's coronavirus travel advisory on Tuesday, meaning that travelers from the Silver State can travel to New York, New Jersey, and Connecticut without quarantining for 14 days. That's all I have for this week. I'm happy to answer any questions.
Thank you, Nicole. I appreciate your report. Do we have any questions for Nicole? Or do we have any questions for Nicole or the sheriff or for Dr. Stringham? Okay, thank you very much. We'll move on to an update from Tiffany Love, Chief Operating Officer, Humboldt General Hospital, on COVID-19 and HGH. Are you on, Tiffany?
Mr. Chair, Dave Mendiola, I do not believe she's on, and I tried to contact her, but she was not available.
Okay, thank you. We'll move on then to the presentation by Resilience Counseling Program, an overview of the Department of Health and Human Services Nevada Resilience Projects Plan for Nevada COVID-19 Behavioral Health Recovery, objective, and services available. Who do we have?
This is Wendy Nelson.
Andy?
Hi, how are you guys? So the resilience counselors, they are actually in a mandatory FEMA meeting right now. And so I don't know, can you put up the slideshow, or should I just kind of go through it real quick and briefly give an overview? What's the best way here?
Do we have the ability to put that up this morning?
Abel, can you, was that on the agenda? I don't recall.
Yes.
Yeah, it is. If not, it's okay.
I'll pull it up real quick. Give me one moment.
You're totally good. That way people can see what the heck I'm talking about here. So while they're pulling that up, the grant is a FEMA grant, and so the state had applied for it. Dr. Stephanie Woodard is kind of over this project, and so because of COVID-19 and where we're headed with, being in this situation, they are looking at it a little more long term, knowing that we don't have a vaccine quite yet and all the things. So this is a 9-month project right now, and they may have an extension on that. So when they pull it up, they're trying to talk about like the phases of a disaster and the response. And so you'll see that when we're in the middle of a disaster, which is COVID-19 right now, there's like a pre-disasters era where there's a warning and a threat. And then the impact starts hitting, and then you'll see an arch where people are heroic and they come together. It's the honeymoon stage where we have a lot of community cohesion. That's probably like month 3 and 4. We're headed into month 7. So we're headed downhill into what we call trigger events. And I think we're all kind of living through that right now, where there's a lot of controversy over masks and different regulations and all the things that we're dealing with right now. And so there's a lot of disillusionment. And so they're trying to have this resilience project be so that we can help do referrals basically to all the agency, like all of you on here. We're going to be doing a lot of referring to the different agencies. In the health districts in the north and the south, they actually have the tracers hooking up the people that have COVID with the resilience project. And so that, if they're worried about food or rent or, mental health things, they can try to make sure that they're guiding them and have a person that they can contact. The state right now is just finally putting together the phone number and the official texting. So they have a text care. So they're putting out a brochure, and I think it's going to hit by the end of this week, but they have a 1-800 number people can call in the state, and also you text care to a certain phone number, and it's going to go to a little bank of people that'll be then sending it out to the different counseling services. So I don't know. I don't think we have it up yet, so I can just continue on here. So they talk about the key concepts of disaster, that nobody's untouched by it, which frankly nobody is. Even our kids, they're feeling it with the friends and the masks. I talked to a teacher yesterday, and she said, the kids are trying to touch each other more than ever, but she said that they're resilient, they're doing everything that they can, and that they feel positive about things. So that's good. And kids are great. They put out a CDC mental health pulse survey, and on there it's indicators of the anxiety or depression based on the reporting frequency of symptoms in the last 7 days. And Nevada ranks 4th in the nation for anxiety disorders and depressive disorders, which is, go down a couple slides. Go down. That's the first one. Go hit a second one here. Yep, there's the disillusionment there. Okay, keep going. One more. Yeah, so that's the go back, the health pulse survey. That's what I'm talking about right now. You can kind of see where we rank. Oregon's first, and I'm sure the fires aren't helping right now, but anyhow, that's where we're ranking. Okay, you can go to the next slide. So basically, the response and recovery activities are collaborating with the divisions of management, supporting providers, promoting the telehealth, and we're developing staff. So they're going through some intensive training. They've been going through suicide training and all the things. Beginning prevention and early intervention. They're trying to make sure that the people have access to services, like I mentioned before. Evaluating the data. And so we're trying to do liaison with partners federally and locally. And so as we're launching this, we're just really in the beginning stages of making sure that everything's off the ground. We have one more counselor that we're going to be hiring, and they're hiring a supervisor. We're talking about having that supervisor housed over at the Boys and Girls Club in Winnemucca. And so we'll see how that works out. And Chad has a resilience ambassador over with him, and we do here as well. They cover multiple counties. So you can go to the next slide. The activities. So there's a little confusion at first. First, they called them crisis counselors, and this crisis counseling system. So they're really not counselors. They aren't competing with our counselors. So that's why they renamed it ambassadors, so that they know that they're really kind of the connection for the agencies, so that, they have a central location. They have one person that can kind of, talk with the families, or, they can go, they're talking about doing presentations to different businesses, because a lot of the people in businesses are really stressed out being frontline workers and things like that. So reaching out through virtual meetings, phone calls, you'll see some of the things listed here. Secondary is social media. So we're going to be posting things through social media. We have several counselors that are bilingual, so in Spanish. A lot of people things that you don't think about, like I have a deaf son, and so there's a lot of deaf people that are isolated in the first place, and now they're super isolated. And they're actually exempt from wearing a mask, and so is the person that would be talking to them, although my son still wears a mask. And so, if they're walking in the store, if you're screaming at him, he won't hear you, for one. And so there's just a lot going on. And so they're even going to do stuff for where they can call in, and if you're deaf, they have some services for deaf people, which I think is amazing. So the strength, you can go to the next slide there. Yeah, so strength-based, it's anonymous. So everything is anonymous. We aren't looking for COVID patients necessarily, and you'll see that in the next slides here. It's just a community-wide effort. Yeah, so there you go. Look at that. They're showing you who's affected. And so in the middle, at the very bottom, you'll see people that have passed away or tested positive. And then you'll see there's frontline workers. That's kind of our next layer and level. And then the people that tested in the immediate family. Even if you are exposed and then are in lockdown for weeks, it can be super stressful because jobs are affected and you don't know what's going to happen and you're stressed. First responders, direct service providers, and then the unemployed, K-12 students. You'll see the different layers there, and then the community at large. So that's the exposure model, and that's who they're working with. And so it doesn't have to be just for people that have passed away. It can be any layer that you're seeing on there. Vulnerable populations, you'll see on the next slide. There's individuals and families who are bereaved, children, youth, adolescents, parents, caregivers. You can kind of see through there. So aging population, that's a big one. With the aging population, a lot of it is isolation, missing grandkids and things like that. Domestic violence. I do know that we're excited for school to be in session because when we had CPS on there, they were saying that they couldn't necessarily go into the homes to see what was really happening, and they knew that maybe some bad things were happening to the kids, and they're just a lot better off if they have like an extra layer of coverage for reporting. So it's great to have the kids back in school. And the next slide, you'll see they're showing where these ambassadors are located. Yeah, on slide 10. So you can kind of see the Boys and Girls Club of Truckee Meadows. You'll see in that first box, Winnemucca is listed there with the Boys and Girls Club of Winnemucca, and they have an ambassador there. And if you go almost to the bottom, the third from the bottom is our Frontier Community Coalition. We have 2 ambassadors. We have 1 hired, 1 more we're hiring. And then the supervisor is on top of basically ours and several in this area. So they'd be over most of the Washoe and anything rural. So what do the ambassadors do? You can go to the next slide. So you'll see contact and engagement, safety and comfort, stabilization, information gathering, practical assistance, connection with social supports, information on coping, and linkage with collaborative services. I know Chad over at the Boys and Girls Club is going to have her even helping with like the food bank, anything where they're passing stuff out to the kids, where they can kind of see if the kids are stressed and if they need help with anything, or so they're directly dealing with the youth over at the Boys and Girls Club. You can go to the next slide. So getting the word out, we're going to be doing a lot with Facebook, Instagram, Twitter. The state's actually doing all of the messaging, and they're just getting ready. They're doing stuff through television and radio. It's going to be in English and Spanish. We're also working with our tribal communities. And so we're going to be trying to reach out heavily into McDermott and some of these other areas to try to make sure that we fill the gaps. Resources through distribution of materials at locations where citizens could receive, so like the food banks, which I just talked about. Next slide is we're making sure we're racially and ethnically aware, and so we're working within the community to make sure there's a clear understanding of the project. We're providing bilingual and multilingual resilience ambassadors, and the staff is representative of all cultural and ethnic groups. Community listening sessions and resilience-based discussions, Black, Indigenous, people of color support network. So they're trying to make sure that we're, we have a very diverse group that they've hired, and they're very aware of each of the areas and what the needs are. You can go to the next slide. Public outreach media, you'll see this is what they're talking about, home but not alone. And this is how they're reaching out to people. And so you can see they're going to be doing a lot of ads and things like that. So that's the end of the slideshow. They just wanted me to kind of put out exactly what it is, but it's not counseling in the sense of meeting with people and counseling them through things. It's really about meeting them and connecting them to resources. So if you have any questions.
Thank you, Wendy.
Yes.
Do we have any questions for Wendy?
It looks like I'm good to go.
All right. Thank you, Wendy. I appreciate it.
Thank you very much.
We'll move on to, I guess before I go to the future agenda items, I'll ask if anybody has thought of any questions for Dr. Stringham and Nicole Maher or the sheriff. Okay, we'll move to future agenda items. The next meeting date. Do we have any future agenda items that anybody wants to see on here? I show the next meeting date would be October 1st. At 9 o'clock.
That is correct, sir.
Okay, any public comment? If we have any public comment from the members of the public, now's the time for you to *6, unmute yourself and identify yourself for the record. We'll take public comment at this time. Any public comment? Is there somebody trying to get on?
I see nothing on this end.
Okay, hearing no public comment, we'll adjourn this meeting at 9:56 a.m. Thank you, everyone.
Thank you.
Thank you.
Thank you, everyone.